So picture this, right? It's a typical Tuesday morning in your house. Your senior Pomeranian wakes up in their, absolute favorite spot. Maybe it's a little patch of sunlight on the rug.
Oh, they always find the sunbeam.
Always. And you look over, and that iconic double coat is still just full and magnificent. The tail still has that proud curl right up over the back.
Yeah, they still look like puppies half the time.
Exactly. And the second you move toward the kitchen, their eyes brighten. There's a bark. Maybe it's just a beat slower than it was, say, 3 years ago, but it is undeniably there. They still have that massive big dog personality.
They still totally think they own the room.
100%. But if you're really watching closely as they get ready to follow you to the kitchens, there's a slight hesitation before they jump off the sofa. Like just a tiny pause that wasn't there a year ago.
Yeah, and that contrast between that fierce, unwavering spirit and a body that is quietly asking for support, I mean, that is something so many people with older dogs know perfectly.
It's so true.
You're looking at a dog whose personality hasn't aged a single day, but their physical needs are shifting in ways that can be, well, incredibly hard to spot.
Right, and that is our exact mission for today's deep dive. We are exploring the subtle, often hidden signs of aging in Pomeranians and how you can adapt to their changing needs.
Which is so important to talk about.
It really is. And I want to set the tone right out of the gate here. This is not meant to be a sad deep dive. We're not here to mourn their youth. The goal is to learn how to keep their world easy and comfortable to navigate based on the sources we've been analyzing.
Absolutely.
So, okay, let's unpack this. I always wonder, when I look at a dog that acts like a puppy half the time, how do we even start to recognize these changes? Like, when does a Pomeranian cross the line and officially become a senior?
Well, we love to categorize things, right? We want a definitive timeline so we can say, okay, at age 8, we flip a switch and start feeding them senior food.
Yeah, you just look at the calendar and go, happy birthday, you're old now.
Exactly. But aging is a deeply individual biological process. Senior status isn't a magic birthday on a calendar. It's really determined by the pattern of change in that specific dog.
Okay, so what kind of patterns are we looking for?
We're looking at their overall health history, their daily mobility, the state of their teeth, and how efficiently their organs are functioning.
That makes sense.
Yeah, because some Pomeranians show age-related changes quite early, while others remain remarkably unchanged until much later in their lives. So the designation of senior really just means your veterinarian is now shifting their focus.
Shifting it how?
Toward building a highly detailed, comprehensive picture of the dog's internal and external health, rather than just routine maintenance.
It makes total sense. But, I mean, it also sounds tricky for the owner. Because I look at a Pom and I see a walking cloud.
A very loud walking cloud.
Right. It is basically an optical illusion. It makes me think of wearing a heavy, puffy winter parka. Like if I'm walking around in a giant, oversized down coat, you have absolutely no idea if I've gained 10 pounds of fat or lost 10 pounds of crucial muscle. I'm just fluffy.
What's fascinating here is how perfectly that parka analogy captures the danger of the Pomeranian coat in their later years.
Oh, really?
Yeah, the coat is a masterful disguise. A senior Pomeranian might be gaining weight simply because their daily activity has naturally slowed down, but they are still eating the exact same portion of food.
Right, the metabolism slows down.
Exactly. Or, on the flip side, they might be losing weight due to underlying illness, or just the natural muscle wasting that often accompanies aging.
And you just can't see it.
No, because of that dense double coat, you won't see either of those changes just by looking at their silhouette from across the room.
So how do we actually know what's happening under the fluff? I assume we can't just throw them on the bathroom scale every morning.
I mean, the scale is helpful for sure, but hands-on checks are absolutely vital. You have to physically get your hands under that coat, down to the skin and ribs on a regular basis to determine their body condition score.
Wait, body condition score, is that like a BMI for dogs?
It is very similar to that, yeah. It's a standard visual and tactile scale that veterinarians use, usually ranging from 1 to 9.
Okay.
So a score of 1 means the dog is severely emaciated, and a 9 means they are severely obese.
And we want them right in the middle.
Exactly. The ideal range is around a 4 or 5. In an ideal state, you should be able to easily feel the dog's ribs under a thin layer of fat without pressing hard, and they should have a visible waist.
But with Pomeranian?
With a Pomeranian, you will almost never see that waist because of the fur. You have to use your fingers.
Right, because they're just a fuzzball.
Yeah. And muscle loss is incredibly insidious. A dog can lose a significant amount of hind leg muscle before you ever notice a difference in how they stand.
Wow, I didn't realize that.
Yeah, which means nutrition cannot just be a matter of grabbing a generic bag labeled senior formula at the pet store. Their diet needs to be individualized based on that specific body condition score, their current muscle mass, and their actual daily activity level.
If we have to actively get our hands under the coat to find what's hidden, it makes me wonder what else we might be missing. And our sources for this deep dive pointed out another major area where problems hide, and it's right in their mouth.
Yes, a lot of older Pomeranians are carrying years of complex dental history by the time they reach their senior years.
I can imagine.
And the very first thing we need to emphasize here is retiring the myth of old dog breath.
Oh man, yeah, people just accept that dogs have terrible breath.
Right, but bad breath is never normal. It is
Yeah.
a sign of actively multiplying bacteria, decaying tissue, and often significant chronic pain.
But dogs are so stoic. If they're in pain from a bad tooth, how does an owner even know? They're not going to point to their jaw.
No, they won't. You have to really watch how they interact with their food. It's subtle. Like, are they suddenly dropping kibble out of their mouth while eating?
Oh, like they can't quite hold it?
Yeah, or are they chewing exclusively on one side of their mouth? Sometimes they might paw at their muzzle or drool more than usual.
That makes sense.
And frequently, it shows up as an unexpected behavioral change. Like, a dog that used to devour dry kibble suddenly only wants soft, canned food. Or a normally sweet dog becomes irritable when you reach for their face.
So they aren't necessarily losing their appetite.
Exactly. They are reluctant to eat not because their appetite is gone, but because the physical act of chewing sends a shooting pain through their jaw.
Okay, let me play devil's advocate here for a second, because I know exactly what a lot of people listening are thinking right now.
Go for it.
Putting a senior dog under anesthesia for a teeth cleaning feels incredibly risky. Like, the fear of them not waking up is huge. Isn't it safer to just let them have bad teeth rather than risk putting an older body through a surgical procedure?
I mean, that fear is completely understandable. Any anesthesia carries risk, and your veterinarian must carefully weigh that against the dog's overall blood work and organ function.
Right.
But the problem is how we view the alternative. The alternative isn't just having bad teeth.
What do you mean?
The alternative is leaving an animal in chronic agony while a biological hazard sits inside their head.
Wow. A biological hazard?
Yes. The gums are highly vascular, meaning they are packed with blood vessels. When the gums are inflamed and diseased, every time the dog chews, micro tears allow the bacteria from that plaque to enter the bloodstream directly.
Oh, wow. So it doesn't just stay in the mouth?
Exactly the opposite. The bloodstream acts as a highway. That bacteria travels straight to the major
That
organs.
sounds awful.
It is. It filters through the kidneys, causing damage, and crucially, it passes through the heart. The bacteria can actually attach to the heart valves, causing severe inflammation and contributing to heart disease.
And an older dog probably can't fight that off easily.
Exactly. An older dog has far less physical reserve to deal with this constant systemic inflammation. So leaving them in dental agony out of fear is a profound disservice to their quality of life.
Because it's draining their whole system.
Right. The daily toll that the infection takes on their failing organs often far outweighs the carefully managed risk of the procedure itself.
So if fighting off that constant dental pain and systemic infection is draining their physical reserve, I imagine it must be exhausting just to get around the house. Is that why we see them slowing down on walks and hesitating before jumping?
The drain on their energy is immense, yeah. But the challenge with Pomeranians is that the spirit is willing, even when the joints are failing.
The classic Spitz personality.
Totally. This breed will still bark at the doorbell, they will still beg for dinner, they will still demand your attention, all while quietly suffering from arthritis.
So they hide it.
Very well. The signs of mobility decline are quiet. It's taking the stairs much more deliberately, or seeming unusually stiff when they first wake up from a nap.
Okay, yeah.
Maybe you notice an occasional skipping step, or a slight limp on a walk that miraculously disappears once their muscles warm up.
You know, here's where it gets really interesting to me. When we see those signs, the stiffness, the hesitation, our first human instinct is to protect them by just stopping the activity. We say, oh, their joints hurt, no more walks for you.
Yes, that is the instinct.
But the research makes it abundantly clear that stopping is the wrong move. I like to think of it as trading in your marathon training for a scenic neighborhood stroll. You don't quit exercising, you just fundamentally change the parameters.
That's a brilliant way to frame it. Muscle is the only thing supporting those failing joints. Stopping movement altogether just accelerates muscle loss, making the arthritis feel significantly worse.
So we have to keep them moving.
Yes. Instead, we adapt the routine. We break that one long, exhausting neighborhood loop into 3 short, gentle sniff walks. And crucially for this breed, we must ensure we are using a well-fitted harness rather than attaching a leash to a collar around their neck.
I'm really glad you brought that up because our sources highlighted that airway and heart issues become incredibly prominent at this stage of life for POMs.
Yeah, the structural vulnerabilities of a small breed's airway do not magically vanish with age. They actually compound.
How so?
Well, the trachea, or the windpipe, is held open by small, C-shaped rings of cartilage. In small dogs, like Pomeranians, that cartilage can weaken and degenerate over time.
Oh, we see.
This leads to a condition called tracheal collapse, where the airway basically flattens like a crushed paper towel tube when they breathe in hard. Neck pressure from a collar exacerbates this dangerously.
I've heard owners describe a very specific coughing sound associated with this. A honking sound. That sounds so specific. Why honking?
The honking sound is the literal acoustic result of air being forcefully pushed through that suddenly narrowed, flattened airway.
Oh, wow.
Yeah, it sounds exactly like a goose honk. You might also notice gagging, or that they're tiring much quicker than they used to, or breathing heavily long after exercise has stopped.
That sounds really scary for an owner to witness.
It can be. As an owner, you need to note the pattern of these episodes. Does the honking happen after they get excited, after they've been out in the humidity, when they are pulling on the leash?
Because that helps the vet.
Exactly. These patterns are critical clues for your vet to assess the exact state of their heart and lung function.
Man, so if their joints ache and their trachea is sensitive to pressure, that has to make everyday maintenance so much harder. Even something as simple as brushing that massive double coat must become a totally different experience for them.
Oh, the grooming table can suddenly become a battleground. An older dog that used to tolerate the brush might start squirming or trying to bite the comb.
I would probably just assume my dog is just getting cranky in their old age or, deciding to be stubborn.
If we connect this to the bigger picture, it is incredibly easy to make that assumption. But it ignores the physical reality.
Which is pain.
Right. When an older dog resists grooming, it is almost never about stubbornness. Simply lifting their leg or turning their body to brush the undercoat can pull on arthritic joints, causing sudden pain.
Oh, that makes so much sense.
Yeah. Or because their mobility has decreased, they aren't turning around to groom themselves as effectively anymore. This leads to hidden mats forming near the skin.
And then the brush catches them.
Exactly. When you run a brush through, it yanks on those mats. Furthermore, aging skin becomes thinner, drier, and far more sensitive to friction.
So while we are navigating the brush through the coat, we need to be actively acting as inspectors for their skin health.
Absolutely. You cannot dismiss changes as just typical old dog stuff.
Yeah.
You need to part the hair and look for unexplained flaking, darkened patches of skin, bad odors, localized redness, or any new lumps.
I imagine it's not just the skin and joints making them seem cranky either.
Yeah.
Our sources went into detail about how fading senses completely change their behavior.
Sensory loss is a massive driver of what looks like a sudden behavioral problem.
A dog whose hearing is fading might startle violently and snap when you touch them from behind. They might not respond to their name when called from the yard, which looks like defiance, but they genuinely cannot hear the frequency of your voice anymore.
They're not ignoring you, they just literally don't hear you.
Exactly. And a dog losing their vision might bark excessively at dusk because they can't identify shadows in the room, or they might seem unusually hesitant on smooth floors because they can't gauge the depth.
That means the burden is really on us to change how we interact with them.
We have to adopt a much gentler, more deliberate approach. Announce your presence verbally, even with a heavy footstep, if they are losing their hearing before you touch them while they are sleeping.
Just to give them a heads up.
Exactly. We also have to rely heavily on consistent daily routines. When their eyes and ears stop feeding them reliable information about the world, a predictable routine provides a necessary scaffolding of stability.
So they just know what's coming next.
Right. They know what happens next, even if they can't perfectly see or hear it happening.
What if the confusion isn't just about a dark room or bad ears? I've heard of older dogs pacing the hallways endlessly at night or getting physically stuck behind a chair and not knowing how to back out. That sounds like something deeper than just needing a brighter light bulb.
Yeah. You are describing the onset of cognitive decline, essentially canine dementia, And it is a reality we must be prepared to manage.
That sounds heartbreaking.
The symptoms can be deeply disorienting for both the dog and the owner. It manifests as that endless pacing or having restless nights where their entire sleep-wake cycle flips.
Sleeping all day and up all night.
Yes. They might stare blankly at walls or suddenly have house training accidents indoors after years of perfectly asking to go outside.
I imagine there are major emotional shifts that come with that level of confusion, too.
The emotional shifts are profound. A dog experiencing cognitive decline often becomes incredibly clingy, highly sensitive to any minor disruption in the household, or suddenly very anxious about being separated from you, even for a moment.
And people probably think the dog's just acting out.
Exactly, and it is critical that we do not label this behavior as the dog becoming spoiled or needy. They are clinging to you because their own brain is failing to process their environment, and you are the only anchor they have left in a confusing world.
Wow. I think of modifying the house for them, like giving an older person a good pair of reading glasses, putting up a sturdy handrail, and making sure the hallway lighting is bright. It's about removing obstacles.
Yes, that's a perfect comparison.
We aren't locking them in a padded room or wrapping them in bubble wrap to prevent all movement. We're just clearing the path.
That is the exact philosophy we want to employ. We add non-slip rugs to hardwood floors so their weak back legs have traction.
Because they can't grip the floor?
Right. We place small ramps or sturdy pet stairs near their favorite sofa so they don't have to absorb the impact of jumping. We provide orthopedic, warmer bedding because an aging body simply cannot regulate temperature or handle drafts the way it used to.
What about the layout of the room?
We keep the furniture layout stable. This is not the time to spontaneously rearrange the living room if your dog is relying on a mental map to navigate with failing vision.
Oh, that makes sense. If they are blind and you move the couch, they're going to crash right into it.
Exactly. We also must change how we handle them physically, using careful, supported lifting under the chest and hindquarters rather than suddenly grabbing them from above.
With all these overlapping possibilities, arthritis, bad teeth, fading vision, cognitive issues, how does anyone actually keep track of what's what? Like, a sudden shift to clinginess could be cognitive decline. But based on what we've discussed, it could also be the pain from a tooth abscess.
It really could.
I feel like an owner could easily just get totally overwhelmed.
You cannot untangle that knot of overlapping symptoms alone, which is why meticulous tracking is your most powerful tool. You cannot rely on your memory.
Especially when you see them every day.
Exactly. When you live with a dog every single day, the tiny incremental changes blur together. You need to track specifics. Their exact weight, their appetite, the frequency of coughing episodes, their sleep patterns, and any bathroom accidents.
Our sources actually highlighted utilizing digital tools for this, specifically mentioning the Vital Pet app to help manage all of this information.
Yeah, using a dedicated app or even just a detailed journal allows you to log these daily data points and spot actual trends over time.
Right.
Because when you walk into a veterinary clinic and say, he seems a bit tired lately, that is subjective.
Doesn't give them much to go on.
Right. But when you bring your app and say, his water intake has doubled over the last 3 weeks, and he has coughed immediately after his morning walk 4 days in a row, that is actionable data. It transforms the appointment from guesswork into a highly targeted investigation.
So what does this all mean for the quality of life conversation? I feel like people view that phrase as this terrifying end-of-the-road emotional cliff that you suddenly fall off.
This raises an important question about how we frame end-of-life care in veterinary medicine. Quality of life isn't a sudden cliff. It is a long, manageable continuum.
Okay, a continuum.
Yes, the assessment shouldn't be an emotional crisis. It should be a practical, calm checklist that you review regularly as an ongoing partnership with your vet.
Like checking in on those daily habits.
Exactly. Are they eating comfortably? Are they resting well without pacing in pain? Are they still experiencing moments of curiosity, showing affection, or engaging in gentle play?
It's not about waiting for a catastrophic failure. It's about daily management and observation.
The dog in front of you is still that same vivid, alert little companion. Senior care is simply about making their life easier to live, one thoughtful, scientifically informed adjustment at a time.
It really is a journey. We started today talking about looking past that fluffy winter parka of a coat to find the hidden physical changes underneath, specifically using our hands to check their body condition.
Very important.
Yeah, and we explored how a healthy mouth prevents deadly bacteria from reaching their heart and why we trade the marathon for a scenic stroll to protect their vulnerable joints and airways.
Absolutely.
And we discuss why accommodating failing senses with gentle, predictable routines and smart home adjustments, like a simple non-slip rug or a ramp, can fundamentally change their whole day. A senior Pomeranian isn't less of a Pomeranian. They just need their world tweaked to match their current abilities.
As we wrap up this deep dive, I want to leave you with one final thought to mull over, kind of building on everything we've talked about.
Okay, let's hear it.
We've spent a lot of time discussing how to keep the physical environment stable, like not moving the sofa so a dog with failing vision feels physically safe.
Right.
But knowing how intensely, deeply attached Pomeranians are to their people, consider how much keeping your emotional environment stable matters.
Oh.
If your senior dog is increasingly relying on your cues to navigate a world that is becoming blurry, quiet, and confusing, they're going to pick up on your stress. Perhaps managing our own anxiety, our own anticipatory grief about their aging, is actually the most important environmental adjustment we can possibly make for them. They need us to be their calm, steady anchor.
Wow. That is a truly powerful perspective. They need us to be steady so they can be steady. Think about that next time you watch them hesitate before jumping off that sofa. Thank you for joining us for this deep dive. Take a fresh look at your senior pets today with a new, observant, and calm set of eyes. We'll catch you next time.